Just wanted to go through another quick feature that I find really valuable and interesting to use with many of the patients that we work with using NeuroVisual Trainer. This is something that can be assigned for home, but it's quite fun to play with during a therapy session. It gives you a good indication of someone's appreciation of depth, how they are able to work within 3 dimensions and their awareness of space. So it's a nice fun activity. It's kind of can break up a session, and then there's a lot of therapeutic benefit. So I'll demonstrate here what we're talking about. So within the tools section of NeuroVisual Trainer, you can see there are these full color anaglyph images, and you can see there's a variety of different options here. So we'll start here with the Fall River Bridge. And in these instances, you're going to be wearing your Anaglyph glasses, the red on the left, and it'll prompt you to set up the glasses in that way if you haven't configured the program. And then as the patient is viewing here, it's actually really fun to play with. You can certainly, again, I know that they mentioned their doctor accounts are free, so you're welcome to play with this a little bit in office. You can see what I'm looking at here is I can see depth within the trees. I can see that the bridge off in the distance. I can kind of see the angle that it's taking as it moves across the river. It actually looks very, very cool. I'm kind of playing with a little bit here, left and right, and you can see it responds really well. It is some real live ability to experience depth. I know there's some websites that people can use for this, but they've actually done a really nice job integrating a ton of different options. You can see we're walking on a pathway. You might be able to, what we'll often do is take this image and we can project it on a larger screen, and we might use it to teach the ability to look soft while taking in peripheral cues. And again, it's a way to just highlight the importance of the fusion between the two eyes to create the highest level of depth perception. Because you'll notice that as you're using it, you'll start to notice that it pops out more or less depending on sometimes the accommodative or focusing response. And it gives you very subtle cues, so patients will be aware of this. You can see they've got maybe 20 or 30 of these. They've got rocket images. They've got a flower image here. It's actually really cool. Yeah, it's kind of a new feature they built in. And again, you can see here are some people, there's some motion and movement. And as you move down, there's increasing demand on the Virgin's response to create the depth. So it's a really nice feature. You can, again, feel free to play around with it. We've had some great response from patients who are enjoying it, using it in office. And occasionally we've been assigning it as a home activity.